Go.
Welcome to Feedback Friday. This week's question is from Aymond regarding his golden retriever, Brees. Mr. Aymond states, "My dog Brees has been a patient at Montgomery Animal Hospital since he was a puppy. When Brees was 3, he started having trouble getting up and moving around during cold weather. We came in for a visit and Dr. Morgan recommended daily glucosamine supplements and a pain medication called meloxicam. The daily glucosamine and medication helped for a while, but then the sensitivity and soreness returned in his hips, especially after exercise. Dr. Morgan told us to continue the joint supplements, and she switched Brees to a new pain medication. Now Brees is 5 years old and still occasionally has trouble with stiffness. What other steps can we take to help our dog as he ages?"
All right, thank you, Mr. Aymond, for the question. We love Brees. Osteoarthritis is definitely a common problem that we see, especially in larger breed dogs, but we can also see this in smaller breed dogs and cats. So if your pet at home is experiencing joint pain, this could be a factor. Usually when we treat osteoarthritis, we are talking about medical therapy. So as Mr. Aymond was saying, we usually look at doing joint supplements daily, such as glucosamine and chondroitin. And sometimes these patients do have to be on pain medications, such as non-steroidal anti-inflammatory drugs, to help to minimize that pain. And usually if we're doing those things appropriately, that will help, and it can be a safe long-term treatment for your pet. But there's a lot of alternative therapies that are really good to incorporate into their treatment plan to help minimize that joint pain and help your pet, experience the best quality of life that they can. One of those things that we need to look at is weight management. So this is a really big factor in these guys that have osteoarthritis, and that's something that's achievable. So even if your pet is overweight, we can help you get to an ideal weight. We can do that through daily exercises that you can do with your pet at home, and we can walk you through some of those in here. We can also talk about diet changes. It's as simple as choosing healthier treats or moving to some of these prescription diets with a restricted calorie intake to help your pet meet an ideal weight. So if you need some help with that with your dog or cat, let us know. And we can even come up with a feeding guideline for you to help meet those target weights. Another thing that we do with some of these patients is a therapy laser. So we have this in the clinic, and it's a laser that your pet comes in for treatments. And these treatments are aimed at decreasing inflammation and increasing blood flow at the site of pain. It's a really cool concept, and it's neat because you can actually sit in on some of these treatments with your pet. And you can see that it's a relaxing experience for them. We've had the laser for several years now, and I think we've had a lot of really good feedback with our arthritic patients that have come in and done some series of treatments with this laser. So that's definitely an option as well. We always encourage comfortable, thick bedding for these guys. So sometimes it's orthopedic bedding that you may need just to give some support to those joints, especially if your dog's sitting on a hard surface all day long, like a kennel, or on a hard floor at your house while you're gone. So we'd be able to walk you through some good options for that provide some relief during the day. And another thing that we like to do with these guys on the diagnostic side is to do some imaging of them, to take some x-rays and to look at that site of pain and make sure that there's not another factor causing pain, outside of osteoarthritis, or also to be able to monitor the severity and the changes that are going on in that joint, as we manage this process over the years. So there's a lot of options out there, and every patient's a little bit different with this. Some things work better for some dogs, and some things work better for others. So if you're having this problem, let us know, and we'll be glad to help you out. And thank you, Mr. Aymond, for your submission.